What if the feeling of being off, the fatigue, the low mood, the sense that you're living in a fog isn't just stress or getting older? What if it's a silent hormonal shift that is robbing you of your vitality and almost no one is talking about the real signs? Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. It is absolutely critical that you stay with me until the very end of our discussion today. Because the final signs we will cover are the most subtle, the most insidious, and the ones most often mistaken for simple psychological burnout or aging. Understanding these could be the key that unlocks the mystery of why you just don't feel like yourself anymore. Today, we are talking about the 10 often missed signs of low testosterone. And I want to be clear from the start. This is not what you think. You might be in the gym every day, you might have a healthy libido, and you might look fit and athletic. Many men I see in my practice who have shockingly low testosterone levels fit this exact description. They are high functioning, they look great, but their quality of life is suffering. They don't feel pleasure or satisfaction. They spend years, even decades, searching for an answer, going to psychologists, getting endless tests for their liver, their kidneys, thinking they need to change jobs or that their relationship has failed. This is why this topic is so important. This one hormone can be the silent saboteur behind a failing career, a broken personal life, and a profound loss of joy. Let's illuminate these hidden signs so you can reclaim your health. The first sign is one of the most surprising and frequently misdiagnosed: problems with urination. I would estimate that 70 to 80% of the younger men who come to me with urinary issues have been diagnosed with prostatitis. Yet, after a proper evaluation, we find no prostatic inflammation at all. The real culprit is a lack of testosterone. They've been to one doctor after another, trying the standard treatments based on old-school thinking, which often ignores hormonal health. Here is the simple truth. A healthy man sleeps soundly through the night. If you are regularly waking up to urinate, even just once near the morning, this is a significant red flag. It's not a sign of aging, especially in a younger man. It's a signal that your body needs attention. This also includes frequent urination during the day, a feeling of incomplete emptying, having to return to the bathroom just minutes after you've gone, a weak or splitting stream, or needing to strain with your abdominal muscles to urinate. Here is how it works. Over a long period of testosterone deficiency, the prostate gland can actually begin to shrink and fibrose, a condition called sclerosis. To give you a practical example, when we treat men with a very large prostate, known as an adenoma, we sometimes use medication to block the effects of testosterone. And what happens? The prostate gland shrinks. So, a healthy prostate requires healthy testosterone levels. Low testosterone leads to urinary dysfunction, poor blood flow, and weakened pelvic floor muscles. The second sign is a change in your hair growth, and I'm not talking about the hair on your head. I'm referring to your beard and body hair. The hair follicles on your face are particularly sensitive to hormonal changes. If you used to shave every 3 days, and now you can go a week or longer with minimal stubble, it's a clear indication that something in your hormonal environment has changed. Pay attention to the speed of growth. The third sign is an inability to lose a specific type of weight: abdominal fat. You may have heard that a man's waist should be no more than 94 centimeters, but it's the type of fat that matters. I'm talking about visceral fat. This is not the soft, pinchable fat under the skin. This is the firm fat that expands from inside your abdominal cavity, pushing your stomach out. You might even be able to feel your abdominal muscles if you press down, but your belly still protrudes. This is an incredibly dangerous type of fat. It's hormonally active, it wraps around your vital organs, and it damages your blood vessels. You cannot exercise this away. If you have a large belly but your arms and legs remain relatively thin, this is a classic clinical sign of low testosterone and requires immediate investigation. Fourth, and this may surprise you, are problems with your joints and ligaments. I have a colleague, an avid surfer, who is fit and active, yet he constantly struggles with knee injuries that simply won't heal. This is not normal. A body in hormonal balance is resilient. If you're an active person and find yourself plagued by persistent injuries, weak ligaments, or aching joints without a clear cause, it's a sign that your body's repair and maintenance systems are compromised. This damage doesn't happen overnight. By the time your joints start to ache, the deficiency has likely been present for a long time, depleting the reserves in your connective tissues. Fifth, let's talk about your body's thermostat. Do you find yourself being the only one in a comfortable room who is sweating profusely? Do you constantly feel hot, or conversely, are you always cold and trying to bundle up when others feel fine? This is a breakdown in thermoregulation. A sudden flush of heat accompanied by intense sweating, especially at night, waking up in a pool of sweat, is a potent warning sign. This can also manifest as an extreme sweat response to minor stress or anxiety. Your body is overreacting because its hormonal regulators are offline. The sixth sign is physical and mental exhaustion. This isn't just feeling tired, it is a profound state of apathy called anhedonia, where nothing brings you joy. The activities you once loved, hobbies, sports, seeing friends, fishing, suddenly feel like a monumental effort. The brain's reward system is broken. You don't get that rush of endorphins, that feeling of satisfaction from accomplishing a task. You simply want to lie down and do nothing. This is not laziness. It is a physiological state. If your passions have faded and your motivation has vanished, it's a serious signal to check your hormonal health. Seventh is a disturbance in your sleep. Most people think low testosterone just means you feel sleepy all the time. Yes, if you feel an overwhelming need for a nap every afternoon just to function, that is a sign. But it also manifests as the opposite. One of the most frustrating feelings in the world is to be utterly exhausted, to lie down desperate for sleep, and yet your mind is wide awake. You can't shut it off. Waking up multiple times throughout the night is another part of this. Any significant disruption to your sleep pattern, whether it's daytime sleepiness or nighttime insomnia, can be linked to a hormonal imbalance. I've known men who suffered for years with only 2 or 3 hours of sleep a night, and once their hormones were balanced, they began to sleep like a rock. Their lives were transformed. Now for signs 8 and 9, which are related but distinct, libido and erectile function. Low libido is when you lose the desire for intimacy. Erectile dysfunction is when you have the desire, but your body does not respond. A decrease in spontaneous or morning erections, a fading of sexual thoughts or fantasies, or a reduced intensity of orgasm are all physical signs that something is wrong. Many men blame their partner or a loss of love, when in reality, the root cause is a drop in their own hormones. It's not just about pleasure, it's about health. Your sexual function is a barometer for your overall cardiovascular and systemic health. And this brings us to our final 10th sign, depression and a pervasive low mood. I see many individuals who spend years on antidepressants with little relief. They go to therapy, they change their lifestyle, but the deep feeling of being at the end of their rope persists. When we investigate and restore their hormonal balance, the need for those other medications often disappears. If you are struggling with your mental health, it is absolutely essential to rule out a physiological cause. So, what should you do? The most powerful step you can take is to get a baseline blood test when you feel good. Know your numbers when you are at your peak. Then, if things change in 5 or 10 years, you have a benchmark. You'll know what your optimal is, not just what the lab considers a normal range. This is the difference between surviving and thriving. It's also important to track your own history. How did you feel 10 years ago? Were you waking up at night? Were you able to stay in shape for summer? This slow creeping decline is what makes low testosterone so insidious. We adapt to our new, lesser normal until one day we look in the mirror and don't recognize the person staring back. As promised, a simple way to begin this self-assessment is with a validated questionnaire, like the Aging Male's Symptoms (AMS) scale. It asks questions about changes you might not even consciously notice. I will be sharing a link to this tool in the description below so that you can begin the journey of self-knowledge. Completing it now and again in a few years can provide an incredibly clear picture of your journey. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.